Good afternoon and good morning. Hello, and thank you all so much for joining us today. Welcome to BioVigil's webinar series. I'm your host, Amanda Holden-Sinisi. And before I introduce our speakers, I wanted to explain a couple of things. And that is first, this is a session for you. So we encourage you to ask questions at any point in time during the presentation. And you can do this by simply clicking on the QA button at the top of your screen. And we will answer all questions at the end of the presentation. And so we are very much looking forward to that. I have the honor of sharing a room right here with our speakers today, Zooming to you live from Lutheran Medical Center in Wheat Ridge, Colorado. Dr. Jessica Strauch is an infection prevention specialist here, and Nomi Hirsch is the VP of Operations. Together, they've created an excellent outcomes for Lutheran, and they're going to share some of their successes with you today that go beyond hand hygiene compliance. So without further ado, I'd like to turn the presentation over to Jessica and Nomi.
Thank you so much, Amanda. I think my name is Nomi Hirsch, and as Amanda was mentioning, I'm VP of Operations here at Lutheran Medical Center. I'm just going to give you guys, just setting the stage for our hospital here in a suburb of Denver, Colorado, just so you get a sense for the setting of where we implemented in BioVigil. So we are a very typical community-based acute care hospital, and we have services all the way from a 5-star birthing center all the way to the opposite end of life with our hospice center here at campus as well. We are roughly seeing around 150, 170 patients a day. We are licensed for 338 beds. We are proud to share that we're the second most busiest emergency room in our state, with an average of around 73 to 75,000 visits per year. So we're fairly busy on that. We have a very heavy senior population here in our hospital. So we have over the years focused in on the senior population and their needs, and we have several services in the hospital that are specifically designed for seniors. And then on top of that, we are really putting a very innovative / efficient perspective on our internal processes to match up and continue to stay alive in this ever-changing healthcare market. So that's just a little bit of background of our hospital here at Lutheran.
So why did we look into electronic monitoring in the first place? The gold standard for hand hygiene monitoring and data collection has long been direct observation, but there are some drawbacks to doing it this way. As an infection preventionist, I try to be out in the hospital as much as possible. When it came to monitoring hand hygiene, the staff always know when I'm there. I will say it doesn't help that I have red hair, so I stand out a little. The Hawthorne effect has been shown to get staff cleaning their hands, and staff members will always clean their hands when they see me walking down the hall, which is great to get their hands clean, but not a very sustainable practice. After infection preventionists conducting the observations, we tried training secret shoppers to collect those. This was not the most reliable data, and it's often very subjective. With the electronic hand sanitizer dispensers, it's very easy to look up every time you hear one of those go off and count that as an observation that someone was cleaning their hands. And in a busy hospital, this is not the best use of time to have secret shoppers. There are some other drawbacks to data collection as well. Getting a high number of observations requires a lot of time and effort on the part of those observers. These observations are also typically pretty limited to day shift workers and select healthcare worker types, primarily the nursing staff. So we began our journey with BioVigil in 2016. We initially had a team that was brought together to evaluate and pilot the product. In August, we began this project by focusing on the emergency department and our largest inpatient unit. At this time, we kept the scope limited and only involved the nursing staff and physicians that were primarily in those areas. The pilot phase was a great learning opportunity where we were able to identify any changes that needed to be made, as well as getting the feedback of staff and patients on what they thought worked well and what did not. By December of 2016, we decided we were ready to implement this process throughout the hospital. This meant implementing BioVigil in every inpatient area, as well as onboarding any department that would have direct contact with the patients and families. We created an elevator speech with the help of some of our frontline staff to get buy-in from everyone this would impact. Having the strong support of our senior leaders in the facility went a long way as well. During 2 very busy weeks, we were able to get our adult inpatient units onboarded, along with numerous ancillary departments. We did a similar rollout a month later to onboard our women's units and NICU and the remaining ancillary departments. I will point out that while we had captured the majority of staff and locations in the facility, there were others that we had decided to put on hold. For instance, any procedural areas were left out of this due to the very difficult nature of their workflows and processes, such as having to scrub in for a case. We have now continued to add various other locations and departments throughout this past year and are now in the process of adding 2 outpatient locations in the near future. We now have over 1,700 registered users and average close to 25,000 observations every day, while maintaining our compliance over 96%. We'd always known that our staff did a great job at hand hygiene. Now we can prove it. While the amazing amount of data has been a great benefit, there have been so many other benefits that we did not anticipate, and we want to talk more about those now. One of my favorite aspects of this system is that it's highly customizable. This has shown to be extremely important for the implementation because my main goal was not to have this interfere with anyone's workflow or change when or how they're supposed to clean their hands. As an example, here's what I'm calling the normal workflow. This is ideally what would be captured by collecting those direct observations. The standard expectation is that anyone entering the patient's room will clean their hands when they enter and when they exit. This does not take into account what happens once inside the room, and capturing the 5 moments for hand hygiene as put out by the World Health Organization. For those moments, we still rely on clinical judgment and necessity for clean hands at those moments. But we know that every situation in the hospital is not as simple as the in and out moments, or even those in-room moments. So here are 2 situations that we have come across that have been great lessons learned. Our first situation where normal doesn't work was seen in our senior behavioral health unit. This unit is in our inpatient facility, but is unlike other inpatient floors in that it deals with a geriatric behavioral health population. With behavioral health, the patients are not encouraged to stay in their room, but to interact and participate in groups in a milieu setting. Along with that, alcohol-based hand sanitizer was very hard to come by on this highly controlled unit. During implementation on the unit, we found that they were struggling to be able to get to the hand sanitizer or sink in the time allotted by the system. We were able to work with the unit and the facilities department to conduct a risk assessment on installing additional hand sanitizer dispensers. We concluded that the installation of locked dispensers was of much greater benefit than risk. Along with that, we were able to modify the system to allow for the additional time to get to the sink or to get to the hand sanitizer and still maintain their compliance. The unit was able to increase their compliance from 85% to now around 95% on a consistent basis. Another situation where normal did not apply was later in the year. Knowing that the workflow for the medical imaging department would be different than a hospital room, we actually postponed bringing them on until August of last year. Once we got the buy-in from the staff, we decided to start with ultrasound, nuclear medicine, and the CT department. After approximately a month in these areas, we learned enough about the workflows that X-ray was also brought on board. There were a couple different lessons learned with the workflow of these groups. The first is that these groups work with more outpatients than we had previously experienced. Their best practice is to go and pick their patient up from the waiting room, and while introducing themselves to the patient, they clean their hands right there. We agreed that it didn't make sense for them to have to re-clean their hands just because they were entering the room. So in this instance, we were able to extend the time that they cleaned their hands and walked into the room, so they still got the credit they deserved. Another lesson that was learned was in working with the CT department. Being that I did not previously know much about their workflow and did not want to make any assumptions, I spent the first day of the rollout down in the department to understand what potential issues they may run into. One of my big takeaways is that they may go in and out of the room numerous times where hand hygiene is not necessary. Additionally, we identified together that they may be entering the room more than necessary, and were able to streamline the workflow that they could do more from the control room. We were able to modify these settings as well. Again, the goal was to make it so they were not having to do extra, but that the system would fit into what they already do. We were able to take the learnings from CT in particular and apply them once we moved on to X-ray. Medical imaging is now one of our highest performing departments, and they average approximately 98% compliance each month.
All right, so I will jump into an additional outcome slash benefit that we saw here at Lutheran that we absolutely did not see coming when we first initially brought BioVigil in to help us, and that is the effect that it has on our sick calls for our associates and staff. So what you see here on this slide is a comparison just for our emergency room where we tracked the sick calls that we had for 2015 compared to 2016 and then 17 as well. And what you see here is that if we just look at the first half of 2016 compared to the second half, which is post-BioVigil, you'll see that the improvement starts coming in tremendously. We initially did not think that this would even be remotely possible for us. So when one of our managers from the ED all of a sudden says, have you even realized what an effect BioVigil rollout has on our sick calls? Both Jessica and myself were like sitting with our mouth and ears and everything open saying, oh my goodness, we did not see this coming. The reason for this is, of course, that our associates are seeing less and less transmission of infections that they're bringing back home to their loved ones. So therefore, the sick calls have reduced as well. What we've done here at the hospital is that we have, of course, taken the opportunity to convert the sick hours into dollar amounts saved, and we're incorporating that in our overall stewardship initiatives around cost savings at the hospital. So this is a great way to add on a benefit that wasn't necessarily what we aimed for when we implemented BioVigil, but it's definitely one of the bigger outcomes that we're extremely proud on top of all the regular outcome data that we've seen for our BioVigil usage.
So this is actually the benefit that I think is probably the most important in being an infection preventionist, and it has nothing to do with infections. But I like to show this every time I do orientation and introduce BioVigil to our new staff members. So I remember probably 3 years ago now, I was a new infection preventionist, and I had to take my son into the hospital. He was having surgery, and I remember laying in his hospital bed with him that night, and a nurse came in to check his IV, and she didn't clean her hands. And me, being an infection preventionist, felt uncomfortable speaking up to her. So you know that these patients and families that come into the hospital, they're not used to this. They're scared, and it is so hard for them to be able to speak up. So with BioVigil, we are actually still able to capture all the hand hygiene data, get all the observations that we need as an infection prevention department, but it's the patients and families that are actually seeing their hands being clean. When we first started this, we were able to do some of the calculations and found that over 70% of our observations actually happen in the patient's room. So that's a huge deal. We're still getting that 25% outside the room, but then they're walking in and they have that green hand on their badge. And so everybody still feels comfortable knowing that they have clean hands.
So I will tag along on just what Jessica is saying here. I think one additional benefit that we maybe anticipated a little bit, but we didn't dare to put it in our hypothesis, was that our use of BioVigil would impact our HCAHPS scores as well and go all the way down to patient satisfaction. It's always a little bit hard to put a direct line between implementing an initiative like BioVigil into a direct outcome on HCAHPS. We have, over the year of 2017, seen a steady improvement in our HCAHPS scores all around, and then we have done several initiatives, but BioVigil has definitely been one of them. What's really impactful, though, to me is that I sit and look every week. I sit and look at our HCAHPS comments that we get in from patients and families. And it's profound that we are seeing specific comments around the BioVigil use. I've copied in just a few of them here, but as you can see, it's extremely powerful to see the perception from a patient or family member's perspective when they see the use of BioVigil here in the hospital. So we have a little elderly woman that commented that she loved to see the green hand, and she looked for it every time someone walked into the room. And then we have others saying that they felt that they were able to ask people why their badge was yellow, because they have heard nurses saying, well, you should be looking for the green hand. All of us are wearing this badge, so you can follow along on whether we wash our hands or not. And I think it's really profound to give the patients and their families, because as I mentioned before, we have a lot of elderly patients here, so we also see family members sitting in patient rooms a lot, and we're giving them an opportunity to really speak up and be able to ask. As Jessica was just mentioning, it's hard even for some insider like an infection preventionist to be able to speak up and say, I didn't see that you washed your hands. But with having a badge on every associate that walks in, everywhere from the one that cleans and empties the trash up until our physicians, it gives our patients and family members that ability to link that comment into a visual cue. So we have had several patients that have had either confrontational or positive interactions with our associates around the color of the hand on the badge. So we have, as you can hear, we could probably speak hours and hours about our journey here with BioVigil at Lutheran Medical Center. We are extremely proud of not just the improvements that we've seen in terms of hand hygiene compliance, as well as our improvements in our reduction of C. diff cases, where this has definitely been a major driver, but also, as I mentioned, our results in associate sick call reduction, as well as improvement in HCAHPS scores. We're not afraid of talking about our journey and sharing our learnings. It has been a learning curve, of course, as any other implementation is. So this has all fitted extremely well in the culture that we have here at Lutheran around trying out new things and see if it helps our patients and our associates as well. So our work has been featured not just in the local news here in Denver, but our partners with Denver Business Journal as well. But we were proud winners last year of a Fierce Innovation Award within healthcare for our work on biovigils. So you would think that we could just sit back and relax and enjoy the results that we have seen so far. And we are to some extent, of course, but the work is not done. As I was just saying, we see this as a journey. We still have opportunities with our rollout of BioVigil. Jessica was mentioning that we started very strategically in some of the high user areas with emergency room and internal medicine, and we have steadily across the last 18 months rolled out BioVigil in additional areas and outpatient settings as well. And we continue to do that. As a matter of fact, I think we're bringing on a couple of new departments over the next couple of weeks. What our focus is for 2018, in addition, though, is to really hone in on our physicians and increasing their use of BioVigils. It's challenging to see that we have some physicians that are completely on board with the use of BioVigil, and their compliance scores, their usage is above the 98% every single day that they're in the hospital. And then we have a group of physicians that still need to get on board with this work and understand why this is so important for us. So that's the reason for why we're focusing on this for 2018. We are being extremely aggressive in our measurements. What really helps us here is that we have a chief medical officer as well as the entire medical executive committee behind us on this. We have all our leaders standing up saying, we have to do this. What we're challenged with here at Lutheran is that we have very few of our physicians are employed. The majority of our physicians are voluntarily coming here day after day, year after year. So this is not an initiative that we can just put on as we can do with our associates. So we have to massage the communication with our physicians and our outcomes in a different way. So we're focusing on that for this year. I want to share that when we brought on our cardiology group not that long ago, I think both Jessica and myself, as well as our chief medical officer, were not very positive. Cardiology has been a challenging area for us to get on board with our initiatives, but I have to share that we have been blown away by their participation and their willingness not just to share the knowledge and the learnings within their own groups, but really standing up throughout the whole hospital and help cherish this work throughout our medical staff.
Thank you so much. It's such a, and I've heard your story so many times, but hearing it live with a bunch of people who are also interested, it makes it that much more exciting. So we do have a couple of questions if you all still have a few minutes.
Sure.
The first one is, how does the system work?
That is probably the best question. So BioVigil, I think one of my favorite things about it is that it is actually minimally invasive. So there are sensors installed on the outside and inside of every patient room. And basically each user wears that little green badge every day. is linked directly to them for their shift. So we can track it for them, and they are actually able, they get their own reports every day as well, or every week. And so it basically, as you cross the threshold and you go across both sensors, if you have not cleaned your hand within the allotted time frame, which is one of those things that you can set for each area, then it will go into a reminder sequence. So we always went with the motto that green is clean, so that was easy for everybody to remember. But then we have it set so if you cross and you have not cleaned your hands, it will go into what they call the reminder sequence. It will do the yellow, it will buzz and vibrate as well. So you're not walking around looking to see what color your hand is all the time. The color is meant for the other people. And then you basically rub the hand sanitizer on your hands, and it's called what's pledging the badge. So you just cup your hand over the badge, and that gives you the compliance. You can also go and do a sink visit, where it's a little bit different in that it doesn't actually detect the soap, because there are like 1,000 different kinds of soap, but it does time you washing your hands at the sink. So for us, our policy says to wash for 20 seconds, and it times you for that 20 seconds. It will then beep and turn blue to let you know that your time is up. And again, just so you keep that muscle memory in your head, you cup your hand to the badge and it gives you credit.
Great, thank you for that overview, Jessica. And if you need more details about how the system works, you can always register on biovigil.com for a demo, or reach out to me directly based on the email that I sent to you with the invitation. We do have another question. I'm going to pass this one over to Nomi. How many staff members are in your facility?
Yeah, thank you. I'll be happy to take that one. So we have a little bit over 1,400 full-time associates here at Lutheran. We have, if we include our PRN staff, we're looking at 2,200. Within our medical staff, we have almost 1,100 providers on staff as well. And then what's remarkable on top of that is, and they're also included in this work, by the way, is we have a large army of volunteers walking in and out of our hospital as well. We are hitting almost 7,000 volunteers here. So we have quite a lot of associates part of this program.
That is quite a lot of associates. Okay, we have a few questions actually. Regarding sick leave, did you benchmark it with a unit without the system installed to ensure that they did not experience the same improvements?
That is a great question, and one that we have actually been looking to answer for a while now. So our emergency department, the manager down there that tracks it is wonderful, and she actually does this manually every day. So as of right now, we do not have another department that we've been able to track this with. We did find out recently that we've had an upgrade to the time system, so we should be able to pull some of that data out and see if the similar improvements were seen in other areas.
Okay. We have another question, and I don't know if you don't want to answer this, is okay, but we'll ask. What was the investment cost?
Ooh, that's a hard one, because that means that I have to go back in my brain to see. I am not sure that I have the exact cost with me. However, what we did do was, as we do with every other initiative that we bring in here, we started out with a pilot, and then we build on that, and we have continued to working with BioVigil on adding on unit by unit. But we of course had to do the return on investment on the initiative as well here on site.
Okay, that makes sense. Another question: how will you handle physician refusal non-compliance to wear a badge?
Yeah, that's always a fun one, right? So I have to say that we have been absolutely fortunate that we haven't had any physicians come to us and straight up refuse to wear the badge. We do have physicians that have received the education, have received a key, and then haven't used it. But there could be several reasons to that. Some of our physicians, as I mentioned before, we have a lot of physicians on staff that are voluntarily here. So it could be because they're just not here a whole lot. And it could also be because they're refusing, but no one has straight up went into an argument with us. What I can share is what we've done with the ones that were more skeptical has been to really sit down and look at our data. I don't think that you will find a single physician that wouldn't support enhancement to reduce hospital-acquired infections for our patients. Everybody that walks in the doors here are here for the sakes of our patients and for themselves, of course, and fellow associates. So when we showed them the data that we saw in our improvements on hospital-acquired C. diff cases, when we showed them the improvements that it really has on our associate sick calls, that was a whole other conversation we had. Maybe it's a little tip of mine, but what I have found very positive and working here in our setting is to really sit down and talk with physicians about data. When you show the data, then you take all the emotions out of the conversation.
Fantastic. All right, another question. Does it only measure within the patient room, or does it also measure in the toilets and clean dirty rooms? In our hospital in Sweden, we can go from a patient room directly into the dirty room and sanitize our hands there, and it is okay. And thank you so much for joining us from Sweden today.
Yes, and that is a great question. So we do have all of our soiled utility rooms set up, and how that actually works is because you're probably carrying something gross and dirty going into the soiled utility room. It actually turns the badge off when you walk into that room, so it knows where you're going and it doesn't expect you to have clean hands at that time. So it's only once you walk back out of that room that it would go into that reminder sequence and have you clean your hands.
Okay, and of course, just from a BioVigil perspective, any room you want in the hospital to be monitored, we can absolutely monitor, but typically we focus on the patient's rooms because they're the most critical. But any soil utility room can, of course, also be monitored as well. And then there are just a couple of questions about viewing, because a few people weren't able to join us right at the top of the hour, and absolutely, our session today is being recorded, so that will be available. I believe I'll either send it out to you directly, or it'll be available on the BioVigil website. And if there are no further questions, I will give everyone just a moment in case there's something that's crossed their mind about our solution and what you all have shared about BioVigil today. And I want to point out that BioVigil, of course, is a great system, but it's really Nomi and Jessica who have put in the hard work and studied the data to see all of these wonderful benefits that Lutheran has been able to capitalize on having such a system. So yes, BioVigil is great, but you know, it's definitely because they've really put a lot of their hard work, effort, and energy into making this program very successful here. Okay, well then, if there are no further questions, we shall wrap it up. And I want to give my sincere thanks to Jessica and Nomi for hosting me here today at Lutheran Medical. It's always great to be out in Colorado. And for those of you who have joined us, please do check out our webinar next month on April 26th with National Patient Safety Advocate Brent Nybarger, who will be sharing a personal story about his experience dealing with hospitals and HAI. So that should also be really great, and we shall learn a lot of new things from Brent as well. So with that, thank you so much for joining us, everyone on the phone. And again, Nomi and Jessica, thank you so very much for sharing your success story.
Thank you.
Have a great day.